Good morning and welcome back. Today we have Dr. Griffin from Atrium Health Navicent Primary Care, Internal and Family Medicine, North Macon, joining us. Thank you for being here.
Well, thank you so much. I'm just excited to be here.
I'm excited to have you here. We have a really serious topic today, diabetes, and it is something that we are just hearing constantly about. So I want to talk about that. What does it look like here in Macon? How many people are impacted by diabetes, and what is it?
So yeah, diabetes is to kind of give a definition of what it is. It's where your body's not processing blood sugar and insulin in the right way. A lot of times it can come from multiple factors, a family history, kind of the foods we tend to typically eat predominantly here in the South, and just a whole lot of things that can come together to cause your body to not be able to regulate blood sugar right. And right now we're seeing about probably 2 out of 5 patients that I currently see at my clinic that are either coming to see me as their new doctor or have continued to see me from the past few years. About 2 out of 5, either a pre-diabetic or full-blown diabetic, and are to the point where they need medication to actually control that.
And is that number normal? 2 out of 5 people you're seeing with diabetes or pre-diabetic, is that normal?
That's kind of the norm for right now, currently, in kind of the past 10 years. Historically, though, diabetes is at the highest level it's ever been, and a lot of that is kind of we're a little bit more sedentary in your typical jobs today. A lot of us doing office jobs, a lot of us working from home. Not getting the physical activity that perhaps our parents and grandparents would have gotten in more manual type jobs. As I mentioned, the good food we love down here in the South, it's really good, but a lot of it can contribute to that, especially a lot of high carbohydrate, refined carbohydrates that we do eat a high proportion of here in the South can contribute to that. And then a lot of people just do have that family history. Another risk factor is if you are overweight, particularly obesity can really give you a higher risk of developing it. We even have where we state that if your waist circumference for women is over 35, or for men your waist circumference is over 37, so the size pants or dress you're wearing can literally predict whether you're at higher risk of developing diabetes.
Wow, and so that brings us to a new assessment you guys have. Can you talk about it? What is it and how do folks do it?
Yes, I actually just used it for myself the first time the other day. So it's the Atrium Health Diabetes Risk Assessment Tool. And we'll plug the location on the screen where you can actually access that and fill out that tool. And what it's going to ask you your age. It's going to ask you if you have a couple of other conditions like high blood pressure or high cholesterol, any history in your parents of diabetes, or any history of a high cholesterol or high blood pressure. All of those which basically predispose you to a greater risk of getting diabetes. And what it'll do is it'll spit you out a recommendation for, okay, this is kind of your risk. Do you probably need to go see a doctor now? Do you need to see a doctor yesterday? Or just kind of what your general risk would be, and you can take those results to your primary care physician and say, hey, if this says I'm at higher risk for diabetes, it'll kind of give us already a red flag. This is big for you. Really hone in on that. Don't let anything fall through the cracks.
All right. And lastly, I know there's a stigma around it. People are scared. People are nervous, embarrassed, ashamed, whatever they may be. What do you want to tell people who think they may be pre-diabetic or diabetic? Why should they be taking this test or going to their doctors?
Yeah. So some of the symptoms you could look for also, just to kind of know if you're possibly even having already undiagnosed diabetes. It's frequent urination, if you're kind of having to go urinate every hour, every 30 minutes. But then if you're also having to drink a lot of water or fluids, you're really thirsty and your body's trying to replace all that water you're losing. Numbness and tingling or burning in your extremities, like your hands and feet. All of this can be signs. I really just want to encourage everybody that it's something that you can actually prevent. So much of the damage that diabetes causes to the body over a lifetime, you can prevent and stop all of that virtually if you tightly control that A1C. That's kind of your average number we use, showing us what your blood sugar has been over the prior 6 months to 3 months. If we get that down, we can literally control the damage that the disease does to your body.
Wow.
It can also involve some, maybe diet modification. Medicines come in, often exercise comes in. So depending on the particular patient and their needs and their goals, we can kind of basically create a regimen of all of those things to help them basically just control their diabetes to the point that it's not adversely affecting their lifespan or their risk of major disease and bad side effects.
All right, so if you think you may be pre-diabetic or diabetic, we'll have more information about that risk assessment on our website, 41nbc.com. Thank you for being here today.
Thank you so much. I appreciate it.
Thank you. Stay with us. We'll have more news after the break.